Now, if you were watching the show last week, you'd have seen Kate speaking about the potential importance of blood plasma donations in the treatment of COVID-19 patients. That day, the number of people offering to donate, check this out, Kate, increased by 300%.
It's a lovely,
Brilliant.
lovely thing. The process, which is similar to giving blood, only takes 45 minutes and can be used to help treat patients who aren't producing enough of their own antibodies to fight COVID-19. And the reason why it cropped up, that I was talking about it, is when Derek first got sick, my husband first got sick, I was desperately researching anything I could do to help as I watched him be consumed by the virus, despite all the brilliant efforts of those around trying to help him in the NHS. And I was told at the time, because it was one of the ideas that I had, what about giving my blood? Are there antibodies in my blood because I've had it? Could that help? They said no, because the trials for it hadn't really started. So I started talking about it last week because I found out that now it is being used, which is fantastic. So joining us now is consultant haematologist Professor Mike Murphy, comedian Hal Crittenden, who had coronavirus and has donated his plasma twice, fantastically, and Anne Kitchen, the first COVID patient to receive the blood plasma treatment, which she describes as liquid gold. I'm going to go to you first of all, if I can, Mike Murphy, Professor Murphy. I find all this incredibly moving, actually, because I think one of the things that people who have loved ones who are affected by the virus in whatever capacity feel is a huge sense of helplessness. I certainly did, and do, actually, to a certain extent. Donating and giving the transfer wouldn't help Derek right now because the damage is done, although we still have hope for the future. But this is something that you now can say is helpful.
It is, and Anne is a great example of that, and we look forward to hearing from her shortly. But we still need to confirm the effectiveness of the treatment in randomized clinical trials. They're the gold standard, where some patients receive plasma, some patients don't, and we compare the results in the two. So we're urgently appealing for anybody who's suffered from coronavirus and recovered to come forward to donate plasma so that we have enough for the clinical trials and we can scale up production so that there is enough to treat the patient, treat many more patients, if the trials demonstrate that plasma is really effective. And we're obviously desperate to find other treatments which are effective for treating COVID. We only have one at the moment, and that's dexamethasone, which has been found by colleagues of mine in Oxford to reduce mortality in patients who are severely sick.
Well, look, let's come to Anne then. Let's come to a living example if people like Professor Murphy are still looking for proof. Tell us the circumstances in which you found yourself becoming the first person to have this in connection with COVID.
I was in intensive care. We had two lovely young lady researchers come onto the ward. They were asking for people to join a trial. So I asked them to explain exactly what it involved. And they said I would be given the plasma from people who had already recovered from the coronavirus, and that it would have their antibodies in it, and they hoped that that would kickstart mine to start fighting the coronavirus first, more. And I just thought, this is something that I can do, and this could help so many people. And I just thought it was right.
And just clarify, so you're just in bed, it's just like taking a drip. So they just threw a drip, was it? And you could just see this plasma at the time? Yeah. And how soon did you recover? I mean, I believe the recovery was pretty soon after it, wasn't it?
A couple of days after. I would say 2 days. I hadn't been eating very well. A lovely nurse who was in charge of the ward for 2 nights come in with a cooked breakfast, and I could actually smell it, and I actually felt like I wanted to eat for the first time. So for me, it felt like it was just a couple of days, and that I felt the difference.
Yeah, no, it's fantastic.
And you start, and that's of course one of the symptoms, isn't it, that some people experience, a lack of smell and a lack of taste. So you knew then that the symptoms were decreasing for you, which was a fantastic sign. Now, Hal, you've had coronavirus and you decided to donate your plasma.
Yes, I did, which wasn't easy for me because I'm one of the most cowardly people about needles and blood and all that sort of stuff. So my sister sent me an email about saying you should do this, sort of knowing that I would be a drama queen about it. And so I did apply and I got accepted. And I think I'm a good example of the fact that if you are worried about this, it's so easy. It's so nothing to be worried about. I used to have a real hang-up about donating blood. My mum used to donate blood, and I couldn't look at her arm after stuff like that. Whereas now, after doing it once, it was just so easy to go back. It was so professionally done, and you get biscuits, and you get coffee and tea, and you get oil. I loved it.
And you do anything for biscuits, and of course, I'm sure. I mean, you're having fun, but the idea that you might have saved a life must be a wonderful feeling.
Well, it is, and it is always lovely to save a life doing something that's really very, very easy, and it's just nice. And I think you were saying this, Kate, at the beginning, that we all feel so powerless at the moment to be able to do anything, and just to be able to do something is fantastic, and it does cheer you up, and it's great to think that this actually might be helping people. It's fantastic.
I mean, Professor Murphy, I feel quite emotional about this because I've spent so long feeling very helpless, and the idea of even just talking about it has encouraged people to come forward and donate, and that might save lives. You say that we still need proof that this is really effective, but there isn't any risk, is there, of people being given it? It's sort of worth a try, isn't it?
Absolutely. As Hal has described, the process is safe and easy, and it hopefully will make you feel good because you're doing something for other people afterwards. And you recover from the plasma donation very, very quickly. You make up the plasma within a few hours. You make up the antibodies against COVID that you've donated in a few hours. And there's no risk at all. So we're really encouraging anybody who's recovered from COVID to come forward and donate. And we're really grateful for you promoting this on the programme again. We hope it's going to have the same effect that it did last week.
So who can actually do it? You say anyone. Is it really anyone? I've got to admit, I haven't done it yet because I was told no, because it wasn't yet part of a trial, so Derek wouldn't be given it and they weren't using it. I haven't actually done it, so I need to do it. I mean, who can?
Yeah, so anybody who's recovered from coronavirus for 28 days, we particularly want to collect plasma from those who are likely to have the highest levels of antibodies. And we found from our testing that those are patients who have been treated in hospital and men and people over the age of 35. So we're particularly appealing to them. Women who have had symptoms but no positive test often have low levels of antibodies, but we're very happy to test and see if the level of antibodies is sufficient to collect plasma to go into the trials.
So just to clarify, Professor, even if you haven't had a positive test, but you think you've had the virus, you can get in touch?
You can get in touch and we will test you and determine if the level of antibodies is sufficient.
And it doesn't matter. You could have thought you had it very early on. There are some people that look back and think, oh, maybe I think I might have had it in February. I might have had it in January. It doesn't matter when. If they think they've had it, they can get in touch.
They can get in touch, but we're particularly wanting to get in touch with people who have been treated in hospital and men who have had symptoms and a positive test.
Sure.
And Anne, you must feel very grateful that someone had donated, so you got the chance to escape the worst of this virus.
Oh yes, me, the family, my friends, so grateful for everybody. And please, if you can help us, please give those little pouches of liquid gold. They're so precious.
Yeah. Oh, well, we wish you a continued... You're doing all right now, are you?
Yes, I'm feeling quite well. I have days where I get very fatigued, but then that's to be expected. But overall, I think I'm doing okay.
Yeah.
Well, best of luck to you, Anne.
Anne, fantastic. Hal, thank you very much. Professor, I have to say, and she, she sat right next to me, and she won't say it herself, but we've got to give Kate some credit here, haven't we? I'm sure you'd want to thank Kate for having said this, because this must have helped your research and your process, 1,000-fold.
Absolutely. Well, as was said at the beginning of the programme, we had 3 times more people coming forward after the programme last week. I hope we will have many more this week. So if you've had coronavirus, please get in touch with us. Come forward and donate plasma. As Hal has said, it's safe and easy, and Anne has benefited from the plasma treatment.
Brilliant. Thank you so much, all 3 of you, for joining us this morning. Kate, I always say this, you're so inspiring at a time like this.
And I don't know about
that. You are. You are.
I'm very emotional about it, actually. Not just the idea that people come forward, but that it might save lives.
Yeah, but we're all watching you and how you're dealing with such a terrible situation, but dealing with such grace and positivity, and it's an inspiration. It really is. So thank you. While we're here, when did you see Derek last? Are you going to see him?
I'm hoping to see him this week.
Right.
Yeah. Well, it was a stable day yesterday, and I'm learning, Adil, that stable is sometimes good.
Right.
As what we want is up days. But a non-down day is something to celebrate as well. So, yeah, but it doesn't necessarily get easier. No.